Malaysia's success story in fighting against malaria. Overview. In reaching zero indigenous human malaria cases in 2018, Malaysia accomplished its goal 2 years ahead of schedule. This is especially impressive given that more than 5,000 cases were reported in 2010. Ensuring prompt malaria diagnosis, treatment and surveillance in remote, hard-to-reach regions played a key role in Malaysia's elimination success. However, the risk of imported malaria remains a key concern. Temporary foreign workers in Malaysia, many of whom are undocumented, may expose the local population to the disease. Malaysians who work outside the country in sectors such as agriculture and logging are also at high risk of contracting malaria abroad and carrying the infection with them when they return home. To stop the cyclical nature of malaria infection, Malaysian officials are engaging with employers to distribute mosquito bed nets, increase indoor insecticide spraying in homes and share information on malaria prevention and treatment. Although Malaysia has successfully eliminated indigenous transmission of all human malaria species P. falciparum, P. vivax, P. avali and P. malariae, the P. knowlesi parasite, normally found in monkeys, continues to infect a large number of people. While there is no evidence of sustained human-to-human transmission of P. knowlesi, and, thus, it is not considered a human malaria parasite, the health outcomes for people infected with this parasite can be serious. At a glance. 0 indigenous malaria cases in 2018. 21 introduced malaria cases in 2018. 485 imported malaria cases in 2018. 12 malaria death in 2018. Dominant malaria species, Plasmodium vivax and P. knowlesi. High-risk populations, laborers, including foreign workers, in agriculture, farming and forestry sectors, Aboriginal groups of East Malaysia. Successes. Stepping up implementation of National Strategic Plan for Elimination of Malaria. Foci with active malaria transmission are confined to a few states. In 2018, the National Malaria Control Programme supported a malaria oversight mortality review and national technical meetings, established an interministerial committee for control of zoonotic disease, improved surveillance by enforcing online case and outbreak registration, and implemented foci investigation and classification. Challenges. P. knowlesi cases account for the majority of indigenous cases, ensuring prompt malaria diagnosis in regions where health services are limited, access to temporary foreign workers who are difficult to track due to the transient nature of their employment. Malaysia has come a long way in the prevention and control of malaria since the introduction of the Malaria Eradication Programme in 1960. In 2011, the program had reached a significant milestone of having less than 1 case per 1,000 population and thereby entered the elimination phase. During the same year, the National Malaria Elimination Strategic Plan was introduced targeting Malaysia as a malaria-free status by 2020. Anuar Yusuf, a product of the MCKK Science Five 1972, did not plan to be one of the important players in the campaigns to ensuring this nation, Malaysia, achieve the target of being malaria-free. He is now retired but still reminiscence on his efforts, his involvement and his hopes in the fight against malaria. Anuar hails from Kampar, Perak. Among the measures taken by the Anti Malaria Programme, or Rancangan Pembasmian Malaria, includes DDT sprayings to all permanent and temporary dwellings. DDT is short for Dichlorodiphenyltrichloroethane, commonly known as DDT, is a colourless, tasteless, and almost odourless crystalline chemical compound, an organochlorine, originally developed as an insecticide. Chemists first synthesized DDT in 1874. A Swiss chemist Paul Hermann Muller discovered the insecticidal action of DDT in 1939. DDT was used in the second half of World War II to control malaria and typhus among civilians and troops. Muller was awarded the Nobel Prize in Physiology or Medicine for his discovery of the high efficiency of DDT as a contact poison against several arthropods in 1948. Another measure in the program is the quality checking of blood film malaria parasite or BFMP. The 100% checking is to be done immediately on suspects and not wait for a peak of fever before examining thick and thin blood films. If the initial film is negative, then it is encouraged to repeat another 2 samples or more, especially at the peak of fever if symptoms persist. Malaria is the #1 cause of child morbidity and mortality. Travelers traveling to malaria-infested areas can become prone to catching it. In cases where patients that were already on antimalarial drugs, measures to cover their immediate families and house contacts are also carried out under this program. Entomological studies, surveillance are also part of the measures taken by the national program. Special entomology team carried out these tasks. These teams are also tasked to make a systematic write-up of findings. Measures also include to plan out drainage and to drain swamps in urban and fringes of urban areas to prevent them from becoming breeding grounds for Anopheles mosquitoes. The last measure is environmental management for vector control, aiming to induce changes in ecosystems that help reduce their receptivity to the propagation of disease vectors. The scope involves examining the local eco-setting of the disease vector and disease transmission patterns, and then systematically design and periodically update strategies and action plans. It could be an underground piping system, spraying insecticides and anti-malarial drains. All these measures aim to reduce to the greatest limits the possibility of an outbreak of malaria disease infestation among the rural and urban populace of this country. Hulu Perak was among the most malaria-prone, disease prevailing all year round, areas since 1950 or 60s. Plasmodia attack the red blood cells in thousands and maybe millions. The effect is the reducing of oxygen intake to the cells. As all the blood circulation goes to the brain, oxygen deprivation of the brain is the